Today, we dive deep into the world of the dengue virus, a persistent global health challenge carried by a tiny insect. While its exact origin remains debated, documented outbreaks of a similar febrile illness date back centuries. However, the modern understanding of dengue really began to solidify with significant descriptions in the 18th century. Structurally, dengue is an enveloped, positive-sense, single-stranded RNA virus belonging to the Flaviviridae family. It possesses 4 distinct and antigenically different serotypes, labeled DEM-1 through DEM-4, which is crucial for immunity. When an infected Aedes mosquito bites a person, the virus is directly introduced into the bloodstream. Once inside, the viral particles actively seek out and begin to infect various host cells, particularly those of the immune system. Key targets include monocytes and dendritic cells, which are essential components of the body's initial defense mechanism. The virus then hijacks the cell's machinery to rapidly replicate itself, creating more and more infectious progeny. Following this initial infection phase, the incubation period before symptoms appear typically lasts anywhere from 4 to 10 days. The illness often begins abruptly with a sudden, high-grade fever that can spike quite rapidly. Accompanying this fever are often severe headaches, especially pain located right behind the eyes. Intense joint and muscle pain, sometimes leading to the nickname breakbone fever, is another hallmark of the acute phase. Some individuals may also experience a rash, appearing a few days into the illness, often spreading across the body. Diagnosis usually begins with a clinical assessment, but laboratory tests are vital for confirmation and tracking. Tests might involve detecting the viral RNA early on through PCR, or looking for antibodies later in the infection. Currently, there is no specific antiviral drug to directly cure dengue infection. Treatment is primarily supportive care. The absolute most critical aspect of management is maintaining adequate hydration to compensate for fluid loss. Patients must be cautious, as using certain common pain relievers, like aspirin or ibuprofen, can increase bleeding risk. Prevention hinges on aggressive source reduction, meaning systematically eliminating all standing water sources where mosquitoes breed. Personal protection is also key, utilizing effective insect repellents and wearing long-sleeved clothing, especially during peak hours. By understanding the virus, recognizing the signs, and rigorously practicing prevention, we can significantly lessen the impact of dengue.